These photos of Emma Stone from Paris Fashion Week have been going around the internet, but did she have plastic surgery?
If you don't know what I'm talking about, Emma and Lisa were at Fashion Week, and this photo was posted of the two of them, and people on Twitter were very quick to address the way that Emma looked. This one tweet has 179,000 likes and over 2 million views, saying Emma Stone's new face is crazy.
As a board-certified eye surgeon specializing in cosmetic eyelid surgery, I'm going to give you a breakdown from an expert perspective here. Make sure to watch until the end of the video and we'll go over what procedures she might have had. If you look at her eyes specifically, you might see a subtle change. It's very important to state up front that I am not Emma Stone's surgeon and I don't know if she has had any medical procedures. This video is my professional analysis based on publicly available photos, and it's really just for educational and entertainment purposes. Keep in mind that things like photo quality, lighting, makeup, and the angle that you take the photo can really affect how we analyze these things. And so let's have a little fun and talk about this. We're going to be looking for some subtle anatomic changes that might tell us if someone has had a procedure or why someone would want to consider having a procedure. Okay, first off, let's look at a photo from earlier in her career to establish a baseline. Looking at photos from around 2014, you can identify some of her natural features. So let's go through this from an eyelid perspective. To me, her eyes really stand out. Now, she naturally appears to have some hooding of her eyelids. That happens to a lot of the patients I see from a young age. A lot of it has to do with genetics, because if you think about it, if the eyebrow bone is in front of the eyeball, that skin is naturally going to want to fall down towards the eyelashes and sometimes even sit on top of the eyelashes from a very young age. And it doesn't indicate a sign of aging. It could very well be genetic. Second thing I'll point out is she has a very gentle and natural brow arch. Everybody has slight differences in their brows, both from person to person, but also from one side to another. And that can be kind of held true as you go throughout life. And then keep in mind the position of the outer corner of the eye. We call that the lateral canthus. Here in this photo, it's in a more neutral position. Pay attention to these features as we look through some more recent photos. Now let's bring up a photo from Paris Fashion Week in 2025. What stands out to me is the appearance of the upper eyelid area. The feature that she may have wanted to address is that hooding that we mentioned that she had from a young age. A common procedure to address this is called an upper blepharoplasty or an eyelid lift, where a surgeon removes a conservative amount of skin and leaving enough behind so you have no problems blinking, and that can improve the hooding and kind of improve the ability to wear eyeliner or eye makeup if that's something that someone chooses to do. Looking at this comparison, I want you to take note of the area just above the eyelashes before you hit that fold of skin. That is called the tarsal platform show. How much of that skin is showing is referred to in our field as the tarsal platform show, and that can be a really key sign of whether somebody has or has not had an eyelid procedure. Think about the tarsal platform show like a stage at a theater where the curtain has come down, where you can just see kind of the very front of the stage. If we were to trim some of the curtain, well, then you'd be able to see more of the stage, and that's the idea behind the tarsal platform show. It's between the eyelashes to the fold above it. That distance is what we call that. In reality, this can create a more open-eyed, brighter look. A lot of my patients feel like they just look more awake, even though they might have felt awake even before they had the surgery. It conveys a sense of somebody being a little bit more alert and awake, as opposed to that more sleepy-eyed, hooded look. Sometimes you can achieve the same objective by lifting from above the eyelids by doing something called a brow lift, because you can see how lifting above the eyelids would also pull that skin away from the eyelashes. I also see a potential change in the shape of the eye. Let's look at that outer corner again, the lateral canthus. To me, in these 2025 photos, it appears to have a little bit more of an upward tilt, and that could be from something called a canthopexy or a canthoplasty. Another variation of this procedure is something called a fox eye procedure, but that lifts more past the canthus to create a more exaggerated appearance there. Think about the lower eyelid shape like a hammock. Naturally, you want to have a little bit of a down tilt to the lower eyelid, and then you want it to come back up again to a sharp point at the corner there. We call that an almond-shaped eyelid. So an almond has curves on both sides. However, if you pull real tight here and do a 𝘾𝙃𝙍𝙅 or a 𝘾𝙃𝑝lasty, it can sometimes kind of flatten that lower part out as if you were pulling the fabric on a hammock tighter and it just became straight across on one side. That's the look that you can sometimes get after a 𝘾𝙃𝙍𝙅, and it can actually connote beauty. It's just that it can also be a telltale sign of a procedure being done. Because think about it, it's not like this skin is going to get tighter as we age. It's going to fall with gravity. Oftentimes we combine a 𝘾𝙃𝙍𝙅 or a 𝘾𝙃𝑝lasty with a blepharoplasty, which is the removal of skin from the upper eyelid, or sometimes removal of fat from the lower eyelid. If you're finding this breakdown interesting and you want to learn a little bit more about the anatomy and techniques of eyelid surgery, check out the other videos on our channel and consider subscribing, as that's what I talk about on our YouTube channel. Now, beyond the eyes, I see some other potential changes. Let's first look at her eyebrows. So in the 2025 photos, the outer tail of the eyebrow appears a little higher. So let's talk about that a little bit. So in general, you don't want to lift the inner part of the eyebrow because that's what makes people look weird and quizzical or surprised. But in general, as we get older, the tail, the outer third of the eyebrow, kind of tends to fall because there's no muscle to pull it up from here. So I haven't had a brow lift, but you can see that my brow is still on the bone here. If you were to pull the brow upwards here laterally, it kind of turns the angle of it so that it goes more straight across and stays high as it goes across the bone, instead of going straight across and then falling back down. That is typically a telltale sign of a brow lift or a temporal lift or a lateral lift. All of those are features of some type of forehead lift that in general rejuvenates that area, and that is what I'm seeing in these photos, is a little bit difference in the angle of those brows. Now, to be fair, that could be from Botox sometimes, although I think the effect of Botox to create this kind of appearance is much more subtle and muted than you're seeing here. Sometimes even makeup and lighting, and especially the angle that you take the photo because somebody might be making a facial expression, can affect the appearance of this. So it's really difficult to say with certainty about a brow lift. Now let's look at the mid-face. There really does appear to be a different contour to the cheeks. So again, as we age, fat generally does not go against gravity in the upward direction. It tends to sag down a little bit and give some of that more hollowed or gaunt appearance, especially as we get sun exposure. And so when you see someone that in a later photo tends to have more volume or a fuller cheek, think about that like a pillow where you added stuffing to it. If you add stuffing to a pillow, it's going to get harder to compress. And so similarly with the cheeks, if you add volume to it, it's not going to show some of those finer lines, and it's going to almost reflect the light off of it instead of showing shadowing and hollowing in those areas. There's two ways to achieve that. You can do it non-surgically with something called filler, which can be done in the office. Or, as my preference is, you can do it with something called fat transfer, where you use your body's own natural tissues. Usually we take fat from like the inner thigh area, sometimes the belly area, and we use that fat to more naturally volumize these areas under the eyes, the cheeks, the brows, and the temples. That's a very common procedure that can give a little bit more youth and volume to areas which tend to sag and hollow out as we age. Another possibility is that it could have been from a mid-face lift. So a mid-face lift is, instead of adding stuffing to the pillow, it's like you pull the pillow from down here up to here. And usually that's done from back here using cameras and long sutures or implant materials to kind of pull up this tissue here, to kind of pull up like this here, to make this volume kind of go up to just under the eyes and the lateral cheek area. Keep in mind, lighting and makeup can definitely affect this, so we really can't be certain. So what's my take? In my professional opinion, I do think there might be some procedures that have been done here between these two photos, possibly an upper blepharoplasty, a 𝘾𝙃𝙍𝙅, and some kind of mid-face volumization. Brow lift, it's really hard to say. I would favor saying yes, but again, the way you take a photo, the facial expression somebody's making, how they're smiling, can all affect where the brow sits, so a single one-shot photo is not going to tell the whole story. The goal of good plastic surgery is to never make somebody look like a totally different person. It's kind of like restoring art. You want to just bring out the features that make someone beautiful and accentuate those more without necessarily wholesale changing them. It's more about enhancing than erasing or taking things away, in my opinion. So what do you guys think? Do you see some of these procedures that I'm seeing? Let me know in the comments below, and check out some of our other videos on eyelid plastic surgery, and let us know if you'd like to analyze any other celebrities next. Thanks for watching.